Hey everyone, and welcome. Today we're diving into something that sounds like it's straight out of science fiction. We're going to talk about how we can look deep inside the human body and watch the heart beating in real time, in incredible detail, all without a single cut. So how is that even possible? Let's find out.
Just let that sink in for a second. We can literally watch your heart do its thing, spot problems, check on its health, and do it all from the outside. It's not sci-fi, it's a real technology called cardiac magnetic resonance imaging, or just cardiac MRI. And trust me, it has totally revolutionized how we look at and take care of our hearts.
All right, so let's get into it. What can this amazing tool actually show us? Let's take a peek inside.
The amazing thing here is just how much it can do. It's not just a simple snapshot. With a cardiac MRI, doctors can check out the heart's basic structure and see how well it's pumping. They can spot damage from a heart attack, see if the valves are working right, and even diagnose really complex birth defects in kids. And here's the kicker, it does all of this without using any harmful ionizing radiation. That's a huge deal.
And we're talking about an insane level of detail here. These images are so clear, they help surgeons plan out incredibly complex operations before they even make an incision. And it's not a one-and-done thing either. Think about this. In Brazil alone, about 30,000 kids are born with heart conditions every year. For them, this technology is an absolute lifeline. It allows doctors to safely keep an eye on their hearts for their entire lives.
Okay, so seeing the big picture of the heart is amazing, but the power of MRI goes even deeper. It can help us find silent threats, the kind of problems that build up without any obvious symptoms. And there's one perfect example of this, a hidden enemy called iron. Now, we all know iron is essential, right? But it's a classic case of too much of a good thing. For some people, especially those with certain blood disorders or who need a lot of blood transfusions, their bodies can't get rid of the extra iron, so it starts to build up in places like the liver and the heart. And this isn't harmless. That excess iron can cause really severe heart problems, and if you don't catch it, it can be fatal. So, here's where we get specific. This is the first number that really matters. Once the iron level in the heart tissue climbs above 7 milligrams per gram, well, that's when the risk of serious problems really starts to go up. It's like the first warning light flashing on your dashboard.
But then, there's this number. If that concentration hits more than 15 milligrams per gram, we're in a whole different league. The danger just escalates dramatically. We're talking about a significant risk of life-threatening heart failure and even early death. So you can see why being able to measure this accurately isn't just important, it's literally a matter of life and death.
Okay, so that's the problem. The huge question is, how on earth do you measure an invisible risk like this? Well, the old way was not great. It meant doing an invasive biopsy. But now, thanks to MRI, we have this incredible, precise way to measure that hidden iron without ever touching the patient.
And the tech for doing this has really evolved over time. The first method, SIR, was pretty straightforward, fast and accessible. But the real breakthrough was a technique called T2 star, or T2 asterisk. So think of it like this. An MRI signal is like a ringing bell. The more iron you have in your tissue, the faster that ring dies down. T2 star is brilliant because it measures exactly how fast that signal decays, and that's what made it the gold standard. And now we've got even smarter tools, like Ideal IQ, that can measure both iron and fat at the same time.
But of course, it's never that easy, right? There's always a complication. And in this case, the wrench in the works is fat. It turns out that having fat in the liver, which is pretty common, can mess with the MRI signal and throw off the iron measurement. So suddenly your accurate reading might not be so accurate after all.
So that's the puzzle, right? How do you get a true reading of the iron when this other thing, fat, is getting in the way and scrambling the signal? It's a classic problem in diagnostics.
Well, luckily, technology has come up with some pretty clever answers. One way is to just turn off the signal from fat. It's called FAT-SAT, and it's pretty effective. But there's an even more elegant solution, and that's where something like Ideal IQ comes in. Instead of just suppressing the fat, it actually separates the signals from water and fat. It's like unscrambling two radio stations that are playing at the same time. This way, you can measure each one perfectly on its own. And just like that, problem solved. This whole iron and fat thing is a perfect example of a much bigger story. We're not just talking about small improvements here. The whole field of cardiac imaging is in the middle of a massive revolution. Things are getting faster, smarter, and way, way easier for patients.
Just look at this difference. It's absolutely night and day. It used to be that a cardiac MRI was this long ordeal. We're talking 40 minutes, maybe even over an hour. And the worst part? You had to hold your breath again and again and again. Now,
With a technology called compressed sensing, we can get these incredibly detailed images in just a few seconds. And you can just lie there and breathe normally. It completely changes the game for the patient. So yeah, the future isn't coming. It's already here. You've got compressed sensing getting images in the blink of an eye. You've got something called 4D flow, which is just wild. It lets doctors watch blood flowing through the heart in 3D in real time. It's like a weather map for your bloodstream. And all that complex data? Tools like Ideal IQ turn it into simple, color-coded maps automatically. No more tedious manual work.
It really makes you stop and think, doesn't it? When we can get images this fast and this detailed, what's next? What other mysteries of the human body are we about to solve? We're not just getting better at diagnosing things, we're literally getting a whole new window into how we work. And the next incredible discovery, well, it might be just one scan away. Thanks for joining me.